You might be surprised to find out that on a weekly basis, I get plenty of emails and messages with pictures of cervical mucus because many people like you want to find out if they have good quality cervical mucus that can help them get pregnant. In this video though, I'm going to tell you what you can do to improve your cervical mucus if you've got none or little cervical mucus. And is cervical mucus really important to getting pregnant? Keep watching so you can find out. But before we go on to that topic, hit the like button if you think that this is an important topic for me to cover to affect and improve your fertility. And if you're over 35, I want to make sure that you go straight down to the comment section and click on the link that will take you to my webinar to support your fertility if you're 35 and over. This is my free training on fertility anti-aging. It's my bulletproof method to improve your fertility if you're 35 or older. Hi, I'm Dr. Mark Sklar, the fertility expert, and I work with couples from all over the world to make sure that they can get pregnant naturally. If you're trying to get pregnant, subscribe and hit the bell so that I can help you too. So, cervical mucus, why is it so important? This video is going to give you all the details that you need to understand and potentially change to improve your cervical mucus. So first and foremost, why is cervical mucus so important? Well, cervical mucus is really important for good vaginal health and environment. It helps to keep the pH in the vaginal canal and the vaginal area proper balance and keeps it all healthy and clean. On top of that, it helps it protects the sperm and transport the sperm to where it needs to go, which is your egg. It also is a great lubricant for intercourse, which we always need because without proper healthy lubrication during intercourse, one, it's hard to have intercourse. It makes it a little bit more uncomfortable, more painful, and less enjoyable. So we want to make sure we have good healthy lubrication, or you specifically have good healthy lubrication when you are trying to get pregnant and trying naturally. Here are some things to consider when we're talking about cervical mucus. First and foremost is what is considered good quality cervical mucus, right? All of you, I'm sure, have noticed that your cervical mucus changes at different times of your cycle, depending on where you are in your cycle, and potentially also depending on your health and how you're feeling. So cervical mucus can shift and be different at different times of your entire cycle. Sometimes it could just be a little sticky. Sometimes it could be a little creamy and white. Sometimes, which is what we're really looking for, is that egg white cervical mucus, exactly what it sounds like. And I'll show you an image of that in just a moment. And then other times it can be more watery. Ideally, what we're seeing is that we see that progression throughout the first half of your cycle. And as you get closer to ovulation, and let's assume, and hopefully all of you, ovulation's around day 14, that starting around day 11 or 12, that we're starting to see a shift more towards egg white cervical mucus and away from the either sticky, watery, or creamy cervical mucus. And that you have that for a few days, 2 to 3 days during that fertile window when you're ovulating. And then afterwards, it can become watery as you're shifting into that luteal phase and then potentially get a little bit drier. That happens because you should be more fertile around ovulation and your body is getting ready to prepare a healthy environment in the vaginal area and vaginal canal for intercourse and to protect the sperm and transport them to where they need to go. So it's a natural process that we want to see happen. Now, there's many patients who email me and say,
so I had good cervical mucus, but I had it well before my cycle, or I didn't before my ovulation, or I didn't have any at all.
These are things that need to improve, and we want to shift those right into that proper time, that ovulatory time and phase. And that's really what we're working towards when we're talking about cervical mucus and some of the tips that I'm going to talk about in just a minute to support you and help you shift that and change that if that is a problem for you. So how do we check for proper healthy cervical mucus? For many of you, if you have an abundant amount of cervical mucus, you might even feel that discharge come out. You might be able to notice it on your panties or a liner, and you're able to check that way. But for many of you, there's not enough during that time. It's not as abundant, and you're going to have to insert 2 fingers to get out a healthy enough amount of cervical mucus so you can start to check it and inspect it. And there's nothing wrong with that. So I've got a little bowl here with an egg. I didn't bother to take out the egg yolk, but we just want the egg white. So what we're looking for when we're looking at proper healthy amount of cervical mucus, and I'm just gonna try and show you here. I'll get a napkin here so I don't drip all over everything. But you see how that's stretchy? Now, I'm not getting enough to be able to do it, but it should be clear, sticky, and stretchy. There we go. Yeah, just like that, and you can see it dripping down. So that's what we want to see. We want to see that clear, sticky, stretchy. So if you're having a hard time, I'm gonna show it here if I can. There you go. See that? Yeah. Okay, so if you're having a hard time knowing what is good quality, I suggest you do what I just did, is crack open an egg, just get the egg yolk, and start to play with it so you can see and inspect what it should look like. It's exactly that, egg white cervical mucus. So poor cervical mucus or having no cervical mucus starts to show that there's potentially a hormone imbalance, and more specifically, lower estrogen levels. Estrogen should be the more predominant hormone in the first half of your cycle, the follicular phase of your cycle, and that helps to support healthy cervical mucus. So if we're having a low amount or no good quality cervical mucus, then that's definitely something that we need to improve. And so checking your hormones, making sure that estrogen is being supported properly is going to be a big piece to that puzzle for you. Also, some things that can affect good quality cervical mucus is candida, or more specifically, candida overgrowth. This is definitely a topic that I talk about often with my patients. I've had it often on many other videos when we start talking about digestive health and fertility, but candida overgrowth can definitely affect the quality of your cervical mucus. And candida can lead to a yeast overgrowth, and this can block the sperm from being able to get through, so it no longer is transporting, being a good environmental transportation piece to get the sperm to the egg. It's becoming a barrier because the sperm can't get through. So we don't really want that, obviously. And so this is definitely something that needs to be cleaned up. There's several pieces to this process when we start trying to clean up the candida overgrowth. Diet is a big piece of that. This is where I recommend to my patients that we cut out all sugar, all processed sugar. We cut out a lot of carbs and go to a more low carb diet. And I also recommend using probiotics both orally and vaginally. A key one that I like to recommend is Saccharomyces boulardii. You can also get a good quality probiotic at the health food store that you can use vaginally. And those are some good simple tips, but often they're not enough to detoxify the yeast and candida and reset things and get you back in balance. And that can take a little bit of time, especially if it's been there for quite some time. So to restore proper, healthy vaginal environment and to get rid of the candida, I'm gonna leave a link to my favorite candida detox below. It is an in-depth program. It does take time, so I just wanna warn you, and can take several months, 2 to 3 months to get rid of it completely, but it's well worth it, not only for your fertility, but for your overall health. You'll feel awesome afterwards. And so I'm gonna leave that link in the comment section below for you to check out and utilize if you think that that's something that you need, or if you've been told that that's something that you need. Another piece to this is birth control pills. I'm not the biggest fan of birth control pills. I'm sure you've heard me talk about that, and that my favorite form of birth control is going to be using condoms or timing the rhythm method. But if you have been on birth control, this can definitely cause your cervical mucus to change and can cause or lead to poor cervical mucus or no cervical mucus, and it can also lead to and you're more prone to have candida overgrowth and yeast overgrowth. So that's something to check out if you've been on birth control for a prolonged period of time. Restoring proper hormone balance is really important to restoring estrogen balance, and often when this is done, we will see good cervical mucus be restored, go back to normal, and we've got a good environment in the vagina to allow for the sperm to get to where they need to go. So what are some other tips to help you restore cervical mucus and proper healthy cervical mucus more importantly? First and foremost is to reduce your exposure to toxins. This is key. Toxins can be found in many different places in our environment and our world today, and that is no different when it comes to this piece as it relates to estrogen. So one is reduce the exposure to toxins in the environment, in your specific house, right? So your cleaning products, the things you use around your home, we want to make those as natural and as safe as possible. And if you're using anything that you have questions about, you're not sure if it's safe or healthy to use, then my suggestion is, if you're questioning it, then change it and find something better or healthier to clean your house or to use in your environment around you, because you're going to be inhaling that, and that is going to affect your hormones and your endocrine system. Also food, tons of chemicals, antibiotics, Roundup, so forth can be found in your food, and we don't want that. So that's definitely something to clean up and be a little bit more careful with, as well as we already talked about the piece of cleaning up your diet when it comes to reducing candida. So that's another way, another reason why you want to clean up your food intake. And then last, the water that you're drinking can definitely have tons of toxins in it. And so you want to make sure you're using a good filter, that you're drinking clean water. And I'll actually come back to that water piece in just a moment, as well as we talk about some other things that you can do to improve your cervical mucus. So why don't we jump right into that as we were talking about water. Hydration is really, really important. Cervical mucus is mostly water, and we need to be hydrated so that not only for our body, because our body needs it, but also our cervical mucus, to create good, healthy, balanced cervical mucus, we need to be hydrated as well. So my 2 tips when it comes to drinking enough water is going to be, 1, drink half your body weight in ounces every day. And if you are drinking a lot more or consuming a lot more caffeine, and hopefully you're not, but if you are, then you need even more water than that, because caffeine is very dehydrating. So we want to make sure that we are staying hydrated, at least half your body weight in ounces per day, and hopefully drinking it in a glass or stainless steel bottle and no plastics. And then mineral water. Specifically, we want to remineralize the water most of the time if we're using a water filter, which is important to get out all the toxins that I just talked about. We do, the problem with using a filter that takes out all the toxins, it also takes out all the minerals. So we want to add those minerals back in so that our cells can get hydrated, because without the minerals in the water, it's very difficult for that water to get into the cell, because those minerals are conductive and they allow the water to get into the cell and rehydrate it. So we want to make sure that we're doing that. Supplements are always something I'm asked about. So when it comes to cervical mucus, supplements are no different. I do think essential fatty acids like omega fish oils are going to be essential in this case. So we do want to make sure you're consuming that, and making sure you're getting a good quality fish oil is even more important, because fish oils, just like anything else, can have a lot of toxins and more specifically heavy metals. So we want to make sure that's being tested and used. And I'm going to put a link to a fish oil down below so that you can get a good quality one. On top of that, evening primrose oil, which kind of looks like a fish oil in a capsule, does help to support estrogen levels and can help to nourish and bring on more cervical mucus in the follicular phase. So I do like to recommend that. Vitamin D is an essential nutrient that I use for all sorts of hormone related balancing. So I always recommend vitamin D and having your levels checked. And then on top of that, something that I often recommend for patients, but it does get customized for each individual based on your diagnosis and needs, is some Chinese herbal medicine and acupuncture, which I love to recommend for patients as well. So those are the tips that I think are going to be important to influencing and affecting your cervical mucus, and hopefully improving the quality of the cervical mucus that you are producing. So for those of you who are 35 and older, the quality of your cervical mucus is just the tip of the iceberg when it comes to improving your fertility. And that's why I created a free training for you called Fertility Anti-Aging, my bulletproof method to improving your fertility 35 and older. If you want direct access to that, just click on the link below. And let's keep chatting. If you want more videos on this topic and anything else fertility related, and you want more conversations with me, then check out these videos right here on how to get pregnant naturally and support your fertility. Until next time, stay fertile.